My name is Nicole Dos Santos. I'm the team lead for the paediatric dietitians here at St. George's Hospital. The role of the paediatric dietitian is to provide adequate and appropriate nutrition for infants, children, and young people, taking into account their diverse needs in terms of their age, family dynamics, developmental stage, and so on. The acute paediatric dietitian takes into account the specific needs of the paediatric inpatient population. So we use evidence-based practice to provide nutritional support, where the aim is to provide adequate nutrition and maintain nutritional status during periods of illness, and also nutritional treatment, where nutrition is the main treatment or a major treatment in a particular disorder. So for example, in Crohn's disease, where carefully prescribed liquid diets are used to treat acute flare-ups of Crohn's disease to induce remission as an alternative to steroid treatment, or in the management of epilepsy disorders, where the ketogenic diet is a recognized treatment for refractory epilepsy where medications have failed to control the seizures. So we know that a child who is well nourished during a period of illness has better outcomes and lower morbidity. Therefore, the role of the paediatric dietitian within the multidisciplinary team is essential.
Hello, my name is Jill. I'm a speech and language therapist on Maybury Sequel Ward, which is a rehabilitation ward for older people. I look after people's speech, language and communication. A big part of my role is to assist in mental capacity assessment and in ensuring that people have the right support to be able to make their own decisions. I also lead on safe swallowing, which is called dysphagia. One of the key outcomes for us is to make sure that people are able to swallow safely to avoid additional lengthened stay in hospitals. We work with the whole MDT to support nutrition. We work with the dietitians and nurses, the doctors and the other AHPs to make sure we're delivering safe care across those areas.
Hi, my name's Josh Young. I'm a prosthetist orthotist and I work here at the Douglas Bader Rehabilitation Centre in Roehampton. So I'm an allied health professional, an AHP. Not many people know what prosthetist orthotists do. Essentially, prosthetists are involved in assessing people who've been born without a limb or who've lost one. So they design and fit prosthetic limbs, so arms and legs. And in orthotics, in our orthotic clinics, we provide orthotic devices, which are things like braces and supports for the limbs, so for the legs, for the arms, and also spinal braces. So a lot of what orthotists do is to do with mechanics, and particularly biomechanics of walking. So in my job I spend a lot of time dealing with people who've got walking issues. So children who've got conditions like cerebral palsy, adults who've been affected by a stroke, multiple sclerosis or spinal cord injury. And we make things like custom braces to help with walking. This is something that's made for a little child with a neurological condition, and we make similar things to these for adults as well. One of the really great things about working here at Queen Mary's is that we're very integrated with the wider team. So we've got inpatient beds for people who've had amputations, and we've got inpatient beds for people with neurological conditions at the Wolfson Centre. And here we can really work as a team. So we work with the medical team, the doctors and consultants. We work together with the physiotherapists and the rest of the therapy teams, and together we can get a really good outcome for our patients. Some of our patients who use our devices, even orthotic devices, aren't able to stand or walk without them. So when you get the right design, when your job has been to design something to work out the mechanical problem, and you get to design just the right thing that enables someone to actually take the first steps, it's really, really rewarding.
Hi, I'm Susie Rogers. I'm a Paralympic swimmer, competed in Rio and London 2012, and I won gold in Rio at the Paralympic Games. I am a prosthetic limb user on the left side, so I wear a prosthetic arm and a prosthetic leg, and I also have a congenital deformity of my right foot, so all of that occurred at birth, so congenital disability. So I've been attending centres all my life, and I've been at Queen Mary's seeing various different people for the last 6 or 7 years, so been quite a while now. I was seeing Ruth, she still looks after my arms. I see Josh for my orthotics for my foot, and I see Snezhka now for my leg. So quite a few people that I've come in to see and have done for many years, without which as a limb user, I couldn't have really competed, and that's the value of the NHS for me, is that I'm able to get prosthetic limbs that I can use in the gym to keep me active, and that I can facilitate a sort of easier lifestyle for me.
My name is Shan Seeley. I'm a neuroradiographer in the Atkinson Morley Wing. I work mostly in CT, MRI and angios, and this is one of our angio suites. This is our biplane suite. The kinds of things we were doing here, we do clot retrievals, which is a 24-hour thrombectomy service, and my role in here would be supporting the neuroradiologists to do the imaging so they can see where they're going with the catheters up into the brain to retrieve the clot. We also do coilings as well, so again I'll be just using the imaging. An MRI, I will be doing imaging of the brain and spine. Again, this will aid neurosurgeons in theatre for planning of operations. And again, in CT, we will be doing imaging of the head and spine, as we're a neuro department. We also do theatre imaging, and we will be using our image intensifier in the theatre to show the neurosurgeons the level within the spine, say. So when they operate, they know that they're going at the right level whilst they are doing the operation. In MRI, we also do research as well, which will basically help researchers in the future.
Hi there, I'm Sally Finley. I'm one of the physiotherapists working for St George's. I've been a physio for 14 years, and our main role is to get people as functional and as mobile as we can, doing exercises, getting them up, encouraging them, things like stretching, strengthening, walking practice, and at the moment I'm working with amputees, so I'm doing prosthetic rehabilitation. So people come in for all sorts of reasons why they've lost legs, so trauma and disease, and we get them in and we try and make them as functional as possible with or without prosthetic legs. So we teach them how to walk with prosthetics and hopefully get them home using prosthetic legs, getting them back to as full of life as we possibly can.
Hi, I'm Lindsay. I'm a diagnostic radiographer at St George's Hospital. No day is the same for us. We deal with a variety of patients across the board for all different types of issues. We have patients that are inpatients that need x-rays to be able to be discharged. We also have patients that we need to go up to the ward and do their x-rays by using our mobile machines. We also assist surgeons in theatre and helping the surgeons guide to where they need to be able to do the job. We deal with accident emergency patients where they come via ambulance or helicopter, dealing with standard things like broken bones from children falling off of swings, etc., to the more dangerous stuff like road traffic accidents. We also have clinic patients that we follow their journey from the moment of diagnosis to the moment they heal. I absolutely love my job and I wouldn't ask for anything else.
Hi, my name's Megan. I'm an occupational therapist and I work in the clinical specialty of hand therapy here at St George's Hospital. Occupational therapy is an amazingly unique and diverse profession, and we work with patients right across the lifespan to help optimise and facilitate their independence in their day-to-day activities and their functional activities. We work in loads of different areas. We work with patients who have mental health issues. We work with adults and children who might have a disability. We work with patients who might be recovering from an injury or trauma. And we also work with patients who are suffering from a chronic illness or a disease or might be recovering from a neurological disorder. Specifically in hand therapy, we focus a lot on people who have problems with their hand and their upper limb. And we do a wide variety of rehab techniques to help get them back on track. One of the big things we do is we make thermoplastic splints, and these splints are designed to help people for a variety of different things. It could be as a result of an injury or trauma. It could be to help support sore joints because of a chronic disease such as rheumatoid or osteoarthritis. We also prescribe different types of exercises, including movement exercises and strengthening exercises to help facilitate normal motion of the hand and the upper limb. And we also look very specifically at functional tasks as well. For example, trying to help a patient learn how to write again, learn how to use a knife and fork, often things that we take for granted that might be really difficult for the patient in the presence of an injury or disease. I think occupational therapy is a really unique and creative profession. I think we're really practical in our approach to how we work with our patients, and we're really great problem solvers that can come at all sorts of difficulties and really try and optimise and find the best way that we can create an outcome for our patients.